Hey guys, this is Stacy from EC Acupuncture School, where we take the mystical and make it practical. Today we're going to do part one of what to do when you don't know what to do. What this is about is basically to provide strategies for you to do when you get somebody that you have no idea how to treat them. And it will happen, and it's okay. I mean, trust me, when you first start out, there's a lot of things that are confusing. A lot of patients come in with very complex patterns and symptoms and problems, and you're like, Calgon, take me away. I don't know what to do. It's okay. I was confused and I was lost a little bit when I was first starting out. So today is going to be oriented towards all of you folk that get in clinic and run across somebody that you don't know what to do with. These are the strategies to utilize to figure things out. It's not going to be the magic bullet, and it's not going to be like this is going to solve all of your problems, but it's going to give you a starting place so you don't feel completely stranded, completely lost. All right. So let's get started. Let me share my screen and then we'll go from there. I hope you guys are having a wonderful, wonderful day. Here we go. Share. And then from the beginning. Ta-da! Magic. So this is called, like I said, what to do when you don't know what to do. Part one. This is one of the shorter lectures that I have. So hang in there. It's going to be fun and exciting. Once again, if you don't know who I am by now, I'm Stacy Hewitt. That's me. I'm a licensed acupuncturist and massage therapist. I've been doing acupuncture for 13 years and teaching acupuncture for 7. Here's my contact information with my channel information. One of the things that I will often say is like, subscribe to my channel, subscribe to the newsletter. I'm hoping that that newsletter link works. If you find that you're having some difficulties with that, here's my contact information for this, easyacuschool@gmail.com. Contact me from there. It could be very well or very much that moving forward, that will be the way that you'll get access to the documents that are related to each lecture. Each lecture, I have a PDF of all the important stuff. So if you want to have access to that, email me or sign up for that newsletter. And as I've said before, I'm not sending you a sale on inflatable baby food, with the newsletter. It's just basically going to be access to these documents so I can keep track of who has access to it, and then notifications for when I put out any new content. So anyway, enough of that, and let's get on with it. So China versus the US. So in China, you have 4 years of school, and then you apprentice under this is Chinese hospital stuff here. You have 4 years, and then you apprentice under what they call a long beard. Basically, it's just a euphemism for somebody that's experienced. They say, the person with the long gray beard is the person that has been around for a long time. I just have a short white beard. So, I mean, short beard, I guess. But you don't get thrown out into the wild. You basically train and then you are observed or mentored by someone who's been around for a little bit. In the US, it's a little different. You get 4 years of school and then 3 horrible board exam tests, and they are necessary. I say they're horrible because they're difficult, but they're necessary because you don't want people out there practicing that don't know what they're doing. Just being able to get a license without taking any kind of test. So the board exams are necessary, a necessary evil. And then voila, you're licensed and you're an acupuncturist. You can go on your merry way, put a little shingle up, say acupuncture, and know very little about what you're doing. But that's okay. That's why time and experience helps. And these videos do too, hopefully. But then the first day as a licensed acupuncturist, you get your first phone call, right? And what does a phone call say? Prospective patient. I've got the Walter Waitley syndrome. Do you treat that? You. No, I've never heard of it. Is it fatal? Is it contagious? That's not what you say. Don't say that unless you don't want any patients. More than likely, you're going to have tons of people calling you with things that you've never heard of. But this is how you deal with it. You say, I've treated a lot of complicated diseases. Chinese medicine is not about treating a disease name. It's about treating an individual. Everybody experiences things a little differently. So why don't you tell me exactly how this disease manifests, and I can specifically for you, and I can tell you better if I would be able to help. So you're already establishing, you don't treat named a disease name. You treat the person. And the way you treat the person is find out what their individual symptoms are. That's what's important, not the disease name. How do you encounter a complicated disease? It's like a puzzle. You you break it down into parts, treat it like a puzzle. Find out what their individual symptoms are, put them together into whatever diagnostic methodology you use, albeit patterns, meridians, however you diagnose things, but break something huge down into little bite-sized pieces. And that's how you're able to figure out what's going on. If someone tells you they have wobble, flip, twitter syndrome, find out what symptoms they're experiencing because not everybody experiences the same thing in the same way. So find out their symptoms, and then you can see if you feel confident to treat them. Here's another example. I've got a woman calls and says, "Bring, bring, bring." Yes, hello. Acupuncture Health Company. That's the name of my business. Hello. And then they say, "I've got the Herbert West disease." And don't go, who? I don't know what that is. Don't say that. Don't say that. Uh, you just say, how does that disease manifest for yourself? Well, the Herbert West disease manifests itself as I've got really poor memory, I'm fatigued, I've got some heart palpitations, I'm dizzy, slightly anxious, I don't sleep, and I feel really faint when I stand up. Well, wait a minute. Oh, that's better. Now it's simple, right? Everyone knows what all those are, right? There, drum roll. It's blood deficiency, more specifically, heart blood deficiency. And we could tonify that with Heart 7, PC6. Both of those tonify the blood in the shin. Ren 14 and 15, those are especially good if they have anxiety. Ren 4, it helps tonify blood. Stomach 36 and spleen 6, they're two of the best points to try to help build blood. There might be a lot of different protocols out there. Some are a little more complicated, but these two are always tried and true, and you see them everywhere. They're really good to use. They're easy. Example two, I've got Crohn's disease. Oh no, don't say that. How does it manifest for you? Well, I have abdominal discomfort. My bowel movements don't really help the discomfort. Got diarrhea, and I've got the big one is mucus and blood in the stool. Oh, well, that's easy. I mean, you don't say that on the phone. But you go, oh, it's easy. It's damp heat in the large intestine. Here's some points. Spleen 9 and spleen 6 helps clear some of that dampness in the lower burner. Spleen 6 helps control blood. CV3 and CV12 help remove dampness from the abdomen. Large intestine 11 helps remove heat. Stomach 37 is lower HC, the large intestine. Stomach 25 helps as a moot point of the large intestine. Also, it stops diarrhea or helps stop diarrhea. And spleen 10 helps with the bleeding, helps stop bleeding. So you see, these things, once you break them down, they're a little easier to navigate. Too bad they don't have a treatment for talking. A little easier to navigate. So let's take a look at something else here. Example 3. The prospective patient calls up, bring. I've got IBS. What do you say? Yeah, hopefully if you guys were here and if I'm in a classroom, I go, yep. It's kind of like at a concert where the folks want you to sing back to them. But anyway, you're supposed to say, how does it manifest? Well, I have anxiety. When I get stressed, my IBS flares up. I've got alternating constipation and diarrhea. These are quintessential signs of IBS. So that's what is it? It's easy. It's liver invading the spleen with spleen chi deficiency. Liver 3 helps calm that, helps stop some of the anxiety. Liver's really big with an anxiety piece. Heart somewhat too, but the liver is a good place to look. Large intestine 4. And not only does it help influence the large intestine or the intestines, large intestines, but those two together, large intestine 4, liver 3, are really great general points for moving the chi around. We're going to talk about those a little bit later in this talk. Stomach 36 helps fortify the center. It also has some shin calming properties too. Stomach 25 influences the large intestine. It helps with pain. So once again, I'm just giving you examples of what people might call with and give you some examples of how to treat them. You don't have to treat them like this, but these are good starts for patterns that you'll see. And they're very, very solid. It might not be that they are miracle cures, but they're very solid. And, well, never mind. So what's the next step? Moving on up. Moving on up. Oops, sorry, wrong way. So after you find out how things manifest, read. Read. Don't, just because you graduated acupuncture school, don't think your nose needs to be outside of a book. I mean, for the first 2 years, your nose needs to be in a Chinese medical text all the time. Reading, learning, researching. Never stop learning. Don't ever feel like you know everything because inevitably you don't in Chinese medicine, but always, always aspire to keep learning, keep training. I mean, I'm taking a class currently right now. So always do that. But if you're completely familiar with what they have or have never treated something like that, hit the books, read. And like I said, for the first 2 years when you're out of school, your nose shouldn't be outside of Chinese medical text. Sorry. Research on the internet. There are tons of acupuncture studies, legitimate acupuncture studies on NIH, PubMed for different things. Look them up. Research. And just because you find a study and somebody has done points for the specific thing you're treating doesn't necessarily mean that you need to use those points. Figure out why they use them and see if there's if those look like they would really work for what you're encountering, or if you could do anything any better. When I first started out, I remember I would always look for studies, and you don't know any better about what they're doing or what they're not doing. And as you get older and more experienced and study more, sometimes you look at the studies and you're like, I kind of see what you're trying to do, but I think you could probably accomplish it a little better. And alternate it. I mean, don't feel like these studies and the points that they used are written in stone. I mean, even though they're scientific studies, sometimes you look at them and like, who did this? Have you studied Chinese medicine more than a couple of weekends? There's a prestigious doctor's certification where they can do acupuncture, but it's something like 8 classes, 8 weekend classes. It's ridiculous. We have to go to school for 4 years, and they can just go and study 8 weekend classes. But anyway, so that's why sometimes I think that you look at these studies and you're like, these points, we probably could do better. And that's probably why you have someone who maybe is not quite as familiar with acupuncture and is writing these studies up. But they're a good place to start. Good place to start to give you confidence. And I say these are must-have books. I don't get any kickback from these, but these are the ones that have found in my practice that helped me, and especially in the early years, especially the practice of Chinese medicine and the obstetrics and gynecology in Chinese medicine books. I really enjoyed. I still use them to this day. The other one, the treatment of modern Western diseases with Chinese medicine, I'd like that in the very beginning. I use that a lot, but I don't use that one quite as much as I use the last two. But all three, if you can get your hands on them, they're really good books to help you figure things out. All three of them. And I don't get a kickback from that. Oh, here it's just reiterating the practice of Chinese medicine. Uh, we've already talked about those, the titles of them. All right. Dangerous curve ahead. This is not how you need to practice Chinese medicine. But what I'm going to do is I'm going to go over a few things that you will very commonly see, and give you some protocols that you could use. And I'm going to give you some protocols for things that you don't know what the heck is going on and you just need to get something done quick. Because with all the research that you can do on a certain condition that a person has, Chinese medicine wise, Western medicine wise, you will inevitably run into somebody that will call you and say, I'm coming over in 5 minutes. And you're like, okay, I've got the time. And then they've got some complicated thing, and you're not going to have time to research. So the next things that I'm showing you are solid treatment strategies that you can pull out of the hat if you need it at first. Learn why we do these, and you'll still use them tens of years later. But in the beginning, these are good starting points. Once you get more familiar with Chinese medicine, more confident, you'll come up with your own strategies. And that is how you practice Chinese medicine, not just memorizing what I'm giving you, these protocols. These protocols are solid, but learn why they work and why you're using them. And that's how Chinese medicine is. It's not about a bunch of cookie cutter protocols. But we all have to start somewhere. Don't don't be poo-pooing yourself, because we all have to start somewhere. I had to start somewhere. Everybody I went to school with had to start somewhere. It's called Day One of Acupuncture School. But anyway, let's look. So the first thing we're going to talk about, you don't have time, like I was just saying. Maybe the person has too many symptoms, or maybe you're just still stumped. Help is there. I mean, sometimes people have a laundry list of symptoms, and you're like, oh my gosh. And you really work on helping them prioritize what's the most important things, and then break it down into little tiny pieces. Try to figure out what it is. Miriam Lee. Miriam Lee. If there was anyone I could go back in time and meet. I mean, there's probably a lot of of acupuncturists that would be cool to meet, but I think she would be pretty cool to meet just because she is the grandmother of acupuncture in the US. And why is that? Well, let's talk about Miriam a little bit. So she was born in 1926, died in 2009. She was a pioneering acupuncturist in the United States and was responsible, catch this, I should have this underlined, responsible for acupuncture being legalized in California in 1976. You know, we think of Chinese medicine being thousands of years old, but in reality, in the United States, it ain't that old. It's not that old at all. I mean, I went to acupuncture school, a long time ago, like 17 years ago, started, I think, something like that. And 17 years ago, 1976 wasn't that far away from that. One of the things that was interesting, I was watching a lecture about Miriam Lee, or someone who had trained with her, and they were saying, in the 80s, if you were an acupuncturist on the West Coast, you had probably trained with her because there weren't many venues of education. There weren't that many schools. There really weren't that many acupuncturists. I mean, good Lord, you look at California now and there's thousands, but there weren't as many. So he was saying that in the 80s, early 80s especially, she was probably one of the people you trained with. So that's kind of neat. But anyway, Miriam Lee was born in China and was a nurse and midwife and an acupuncturist there. And she left in 1949 for the States. In the United States, none of that stuff transferred. Not her nursing, her midwifing degree, acupuncture degree. In the US, Miriam had to work as a factory worker, believe it or not. And on the sly, down low, on the down low, she treated people at her house. And she has a book, and at the end of Miriam, this section on Miriam Lee, I think it's called something about a senior acupuncturist, diary of senior acupuncturist, or memoir of a senior acupuncturist. Pick it up. It is an easy read. It's only probably 50 or 60 pages, 80 at the most. And it's very inspiring. It's very inspiring. But anyway, she was a factory worker and she treated people on the sly because acupuncture was, catch this, illegal, illegal at the time, right? So she had to do it on the sly. And then some one of her patients told a doctor about what he was getting done, and then that doctor was like, no more. And it's the Western med doctor, and he was like, we're shutting her down. So in 1974, Lee was arrested for practicing medicine without a license. But at her trial, all of her patients filled the courtroom to protest her arrest, claiming their right to the only medicine that had truly helped them. They were in the courtroom filling it up, and they were circled around the courthouse. I mean, It's really impressive. It's really impressive. And within a few days, acupuncture was legally made an experimental procedure by guess who? The governor at the time, Ronald Reagan. Wow. In 1976, Governor Jerry Brown signed legislation to legalize acupuncture in California. Guys, legalize it, right? To legalize it. She talked in her book, she talked about when she was treating people on the slide, she had her a treatment room was like in the upstairs of this outbuilding, a garage or something. And she would have people lined up the steps and all the way around the building. She would say she would worry about the steps collapsing on people because there were so many people crowded on those things. So it's very inspiring to see. It's like that, movie or something like that, like a movie or something, like the music starts and then all of the patients flood into the courtroom right as the judge is getting ready to hit the gavel saying you're guilty. Um, it's amazing. It's really amazing. And that's why I said that I would have liked to go back and to go back in time and meet her. I think it would have been neat. But Miriam saw all of her US patients were sick and depressed. And her protocol was from the Neijing, and it's like when the stomach and spleen and the central jiao are attacked by emotions, pure chi cannot ascend to the brain, cannot get up here, and the evil chi, the waste cannot descend. You can't poop it out. You can't get it out. It will remain stuck. So that's how she treated all of her patients. And I know you're like, you can't treat everybody the same way. Well, yes, I agree, but she sure as heck did and had a lot of great results. And if you read her book, she has some other little varying techniques about which way did she twirl the needles. So not everybody was treated exactly the same, but they all got pretty much the same points and really had a lot of really great results. So her treatment was LI4, stomach 36, large intestine 11, lung 7, and spleen 6. And all of those were really about trying to get the good chi up, the bad chi down, and to get things not to be stagnant in the middle. So she would also sometimes use stomach 36 if the chi was really stuck in the center jiao, and helps the evil go down. Large intestine 11 and large intestine 4 also helps the bowel movements. She really felt that clearing the waste out was very important. It also helped move qi and blood via the yang ming, because the yang ming has a lot of energy in blood, so it's moving that stuff around. Lung 7 helps strengthen the lungs. More oxygen, the more energy you have, and helps the lung qi descend when there's a cough. It helps with the whole kidney lung interaction. And also, this is interesting too. She had this whole theory in her book about how the lungs also help with chi stagnation. It helps. We always talk about the liver being involved with the smooth flow of chi, but there's also sometimes in the classics you see where they will talk about the lungs being like this bellow mechanism that helps pull the chi out of the liver. So if it's stuck, sometimes you can work with that chi stagnation via the lungs, but to try to pull start the chi. It's kind of like pull starting, a lawnmower, right? You pull on it and finally you get the engine to start. The same way with these lungs and the liver. You pull start the liver, so to speak, and get the lung the chi stagnation unstuck. So here's her book here, Insights of a Senior Acupuncturist. Very quick read. It's good. Check it out. The next thing you could look at too, these are all, you don't put all these all in at one time. These are just different things that you could potentially select from, called the four gates. And everybody knows the four gates. It's large intestine 4 and liver 3. And you see the four gates, you know, a lot of times you'll see where people will talk about they'll cure anything. That's not the case. They're really good for motivating and moving the chi around. But let's look more depth with them. Sometimes I'll see where, eh, well, where I'll see, like I said, where there's claims that the four gates does do everything. And then what happens and why the four gates sometimes they get a bad name is that's all people do. And they're just like, well, I'll just use these 4 points and woo, you're healed. And yes, they're powerful points, but they may not be the only points that you want to put in. And so that's where they get a little bit of a bad name. Like I said, everybody says they can do everything, or not everybody, but a lot of people say, oh, they can do all this stuff. And then they just do it, the 4 points, and then they don't get, great results. So let's look at them, and they do a lot of really good stuff. And I wouldn't have included them if they didn't. But let's talk a little bit about what they do. Four gates. The big thing is circulation. They help promote the circulation of blood and chi, and we're going to talk about why in a second. But they're really great points for when you have liver chi stagnation to move the energy, especially if you've got something going on with the liver and somebody's a little depressed or they're to have a bad mood or something like that. They really have this chi stagnation issue that's affecting their liver. Then check these out. These can be a kind of a go-to. Liver regulation. The four gates can help regulate the liver because you're using liver three, right? The 1 point. Stress reduction. The four gates help reduce the effects of stress on the body. It helps with that liver chi stagnation, which is stress, stress, stress. That's what stress is, right? Pain relief. The four gates have been shown to be effective in treating pain. It's because they're moving chi and blood, and they might have a little bit of an analgesic effect, but well, if you ever see somebody that goes, "Oh, just use the four gates and all the person's pain will go away," you probably need to use a few more points or a few more techniques than just the four gates. And immunity, they're really good about boosting the immune system too. They help, once you get this chi and blood moving, it makes people feel a little more vital. So, like I said, the four gates, they circulate chi and blood through the body. They help open all the meridians. They increase circulation, thus decreasing pain. Um, and then emotional issues, especially feelings of being trapped or stuck in a situation, which are two big liver symptoms. How do they do that? Well, it's the first Yang Yuan point and the last Yin Yuan point in the circulation order of qi. This polarity has a strong effect on moving the qi through the body, from the beginning all the way to the end, the yang to the yin. So the large intestine yang ming is full of blood and qi. We've talked about that. So if you get that energy moving in there, then or that meridian moving has a lot of blood and chi. So you can get a lot of vitality from that. And the liver, what does it do? Its main job is to smooth and course the chi. So it's moving things around. So that's why the four gates have an effect. Here's my four gates. I still like large intestine 4, liver 3, yin tong. I love yin tong. I mean, if you have studied with me, you know I love yin tong. Yin tong's just a really great all over Shinkaning point. It's easy to get to, easy to put in, and everybody loves it. Should be a show. Everybody loves Yin Tong. That would be a good comedy show, right? So plus, these are the add-ons that I would do with the four gates. CV12, stomach's 25, that helps support the middle jiao, and the postnatal chi helps separate the pure from the impure. So it helps get that middle jiao going. CV6 if the person is fatigued, or CV4 if there is a kidney energetic issue. So, dealer's choice there, but use those 4 points, and those 4 points will help get that chi moving around in the stomach. So that's my four gates, right? So the next treatment you could look at is the EET. It's Van Gie's treatment. He liked using large intestine 7. I mean, sorry, large intestine 4, lung 7, stomach 36, and spleen 6. This, what he called a sacred formula. It's a transversal low technique. It's used to mobilize Wei Qi, clear heat, enhances the classical order of circulation from lung 7 to large intestine 4. The energy transformation that happens in the transversal lows, moving in from that large intestine 4 to lung 7, helps build momentum in the energy. Suddenly they start feeding off of each other. They start going back and forth, right? Yin creates yang, and yang engenders yin. So you get this movement, this flywheel effect going between those two channels. Then suddenly everything builds and builds and builds and builds, and it gets really great, really big. So this is another treatment you can look at if somebody is really low in vitality, low in energy. This is another good point protocol that potentially you could use, right? You're going to figure out how to best treat the person when you gain more experience, more patient interaction, but this is a good place to start, okay? Not just this, but this or any of the other treatments that I've mentioned so far. Good starting points, but you'll figure out and make this stuff your own, okay? So a more simple way of looking at the EET lung 7 is the transversal low for large intestine. It will shunt yin circulating from the circulation from outside to in. Yeah, it looks like a little typo there. Sorry. Large intestine 4 circulates yin to the stomach. Gets it down there. You can use stomach 36 to help the downward flow, circulate the yin energy in the way towards the feet. Spleen 6 generates that upbearing motion that you get from the spleen, that energetic holding things up. That helps the yin move upward. It helps complete the circuit of dissension and ascension. Dissension and ascension. So that, like I said, that's it's a good treatment for someone that's low in vitality. Here's another guy. Golden Needle Juan Lating. Old Juan Lating was called Golden Needle because he used only golden needles. It's adjusting my screen a little bit, sorry. And he used those up until, I believe, the 80s. And around the 80s is when we started to see individually packaged disposable needles. I just fact checked that or looked that up, and it looked like in the 80s, the disposable needle was created because of a hepatitis outbreak over in the UK in the late 70s. So anyway, old golden needle. I mean, before that, people used to have just one, I guess, set of needles, and they would autoclave them. Or I was reading something about a patient talking about, yeah, well, you would go in and the acupuncturist would give you a set of needles and say, this is your set of needles. Don't lose them. They'll cost extra next time. But anyway, Golden Juan Lating was recorded a little grumpy when he had to give up his golden needles and move to a more streamlined, disposable needle methodology. He died in 1986 at the age of 88. He was the chief acupuncturist and head of the Department of Acupuncture at the West Garden Hospital in Beijing. Prior to 1949, he used solid gold needles Even after he stopped using golden needles, everyone kept calling him Golden Needle because his treatments were as good as gold. So his main treatment was called the old 10 needles. It was called the old needles because these points were some of the oldest acupuncture points found in the Neijing. And also, the Chinese considered these to be reliable and time-tested points. And in Asia, the old is what is respected, or at least at the time, the old is what was respected. So old pin needles, an old golden walletine. So let's talk about them. So his old 10 needles were CV13, CV12, CV10, CV6, stomach 25, PC6, stomach 36. And you can tell, like as this says, it's like a lot of the focus is on the gastrointestinal system, the middle jiao, right? It's good for any liver, spleen disharmony, or liver attacking disease. If you've watched uh, previous video that I lectured that I did, who's on what team, I think that's where we talk about, or you get to see all the places that the liver will attack. So this is good for that, especially when it's attacking anything in the middle jiao area. This protocol regulates the center and boosts the qi, which is very important. Some add-ons you could do. So if there was lower burner problems, such as urinary or menstruation or menstrual problems, you could do CV4, CV2, spleen 6. Spleen 6 would be, especially if there are menstrual issues, because spleen, three-leg yin, right? That it helps with the liver regulation of the blood. Also, I took a class one time and they used to say the spleen was the bat phone to the uterus, which I thought was very funny. But so it can definitely affect the reproductive area as well as the liver disseminating. There's a little liver where my head's at, and it's disseminating the qi. If you need to drain heat, the yang ming, like sinusitis, stomach 44, and if you have excessive liver stagnation in the center, not the center, you could look at liver 13, gallbladder 34, and liver 3. So liver 13 was the point that Golden Wand used. I have gallbladder 34 and liver 3 in red because those would be the points that I would add on. With liver 3 and gallbladder 34, especially if you have already CV12, has this nice synergistic effect that helps really circulate the qi in the middle jiao. So anyway, that's old Golden Wand Latine. Next stop, crazy town. So what do we do when somebody's going a little crazy? Unless a person is psychotic, manic, or completely void of emotions, the heart is probably not involved with their shin issues at the time. Try to sleuth out which phase is involved. Are you worried, sad, you're frustrated? Those or scared, sorry, about the last one. Um, worried, scared. My brain is not working today. Worried, scared, fearful, or sad. I don't know why my brain's not working. I apologize. Try to sleuth out. Is there a specific emotion that's the biggest piece of the puzzle? And if it is, focus on that system, the spleen or the lungs or the liver or the kidneys. Focus on that. If you can't figure it out, go back to the four gates. The four gates will help move the qi, which a lot of times when we have any emotional content, there's some kind of emotional cheese stuckness in there. So those are the good first steps. I've got a whole class on really how to become a super sleuth in emotions, but I haven't put it out yet. That's going to be CEU class. That's down the road a little bit. One question that rules them all. Now, this is really important, and this is Stacy, but this is a really great question that I've used for 13 years. When in times of duress, we can experience a gamut of emotions. We could feel sad, we could feel worried, we can feel angry, frustrated, we can feel fearful. We can experience all of these emotions, but usually one is more present. For you, which one seems to be more present? That will help you figure out which specific emotion is going on. And I have underlined there, we can experience all of these emotions. Because as soon as you ask this, they're going to say, oh, look, I feel everything. And then you'll have to go back and say, well, is there one that's more present than the other? And then they'll say, oh, well, yeah, I do worry a little bit more, or I get pissed off real easy. I get angry. Just ask them this question, and that'll help you figure out if there is one emotion that's more so. Sometimes all of them are the same, and that's a whole another kettle of fish that you need to check out my CEU class on, because that's a longer discussion than what we have here today for this. But ask them this question. It's $1 million question. Woo! Crazy town, right? So when we were talking about before about, you know, probably most emotional things are not the heart. They can get into the heart. They're not the heart. But when you see this dude, it's probably the heart. Because that guy looks crazy. So, hello, crazy. Probably the heart. According to Chinese medicine, when you see the white parts of the eyes, the sclera, all the way around, usually means something's up. Usually we see a little bit of white on two sides, but then what they would call it is three-side white. If you could see white on a third side, then one of the things was it represents a physical imbalance in the body and is claimed to be present in alcoholics, drug addicts, and people who consume sugar or grain. I don't know about all that, but usually if you could see three sides white where, oops, sorry, I'm throwing my glasses around, where somebody's like coming into your office and their eyes are all big like this, usually you know that you're in for a roller coaster ride, unless they're like um, hypothyroidic, and sometimes that'll cause. I'm not hyper. That's what I'm going to say. Hyperthyroidic, and that'll sometimes cause people's eyes to be a little wide, but three-side white. It's not that is not a diagnosis on its own. Doesn't mean that's what's going on, but that's one of the things that you can put in the bucket to let you know that maybe something's going on. Oh, and then here's the upper sclera. If that's visible, it is said that it indicates mental imbalances such as psychotics, murderers, and anyone regretful. Stress and fatigue may also be a cause in either condition. So, like I said, I don't automatically assume that this is just from a Chinese medical text that I pulled this from. Don't automatically assume that that the person's a murderer that's come into your office if they're three sides white. But like I said, you just know that something's up. shin calming treatments. So, why, yes, I'm a little bit stressed. Why did you ask? You know, you have people to come in like that. Right, so how do we calm the shin down? So the oldest prescription for calming the shin, the oldest prescription is Heart 7, Sindal 6, Yin Tong, and Spleen 6. There are many points and combinations that exist in acupuncture for the purpose of relaxing the nervous system. This prescription is found in the Neijing. This combination is probably one of the most oldest and renowned for this purpose. It is used to relax the heart, calm the shin, relieve tension and anxiety, and treat insomnia. So, like I said, you need to be a detective to figure out what's causing their stress, what emotion is their emotional piece that's causing their stress. But if you can't figure it out or just don't know, you use this and at least they will feel relaxed. You know, we want them to feel more than just relaxed. But this is a good starting point, and then you investigate more. So I think that's the last slide. This was a very short one. There's a part two. Check out part two because it's very important. But see you guys. Like, subscribe to the newsletter, to my channel, or email me at the easyacuschool@gmail.com if you want to get access to any of these lectures, the documentation that goes with them, and I'll see you soon. All right.